Hi there, you might know micro applicators. They come usually in the same package with your adhesive system or any liquid that needs to be rubbed onto structure. Do you know that they are not all the same? That they are different, especially today in adhesive dentistry, where often you need to rub the surface to remove the smear layer. These small little helpers are gaining popularity and are very important to achieve a good and long-lasting bonding. So let's take a look. They come in different application forms. Basically, one is that the brush is attached to the applicator directly. You have the standard version, the bristles, the classic brush. And you have micro applicator brushes where fibers are attached to a plastic handle. They come in different sizes and different dimensions. So basically, these are the three forms you can see again on this image. Now let's talk about why micro applicators might be the best option for you and what you need to take care of. And maybe what might a little bit less good for your dental workflow. Standard micro applicators, as I mentioned, have these fibers attached. They are bonded to this plastic handle. Less quality sticks or micro applicators brushes tend to lose these fibers when being used on a surface. This might interfere with the bonding strength of your restorations or even have a light impact on aesthetic results in the front when fibers are on the surface of the restoration. The other thing you have to look at is not only the dimension, but also the quality of the bristles. Another important feature is how bendable these micro applicator brushes are. So the standard micro brushes can be bent in one direction, let's say in different amounts, to access cavities in an easier way. I don't recommend using low quality bristles. Pre-attached bristles are good for applying, for example, hydrofluoric acid to a ceramic surface where safety is also an issue. I don't know if you have heard about ZerofloX. That's a new generation of micro applicators. They come in one size, which allows you to cover the majority of clinical applications. The attachment part is very thin, so that it also goes easily into smaller cavities. That's one thing. Second thing is these bristles don't fall off. They're not standard fibers. They use an elastomer material that is non-absorbing, drip-free, and elastomer bristles minimizes material waste by up to 60%. It also provides superior liquid carrying and release properties, holding just the right amount of material, maximizing efficiency. In addition, we not only have one bending option, we have two bending options. So we can double bend this applicator to really access cavities much more easily. So these are the main highlights of the ZerofloX micro applicator that you need to level up your workflow, make it easier, make it more reliable, more consistent, and level up also the quality of your dentistry. Give it a try.